Bob has 37 chocolate bars. He eats 29 chocolate bars. What does Bob have now?
I don't know.
Diabetes.
Oh.
Diabetes.
I don't think that a lot of people really understand. Excuse me, that's my blood vessel.
Neal's not healthy.
I'm healthy.
Hi everybody, welcome back to Wellness Wizards. Today we will be discussing diabetes.
And sugar. Because they go together. Okay, so today we're going to play a little game. Kind of like a video game. You know how in video games there's different scenarios, right?
Nope.
What do you mean, nope? There's different scenarios. Like you can choose different things that you're going to do.
Like in the Mario Kart racing, different backgrounds and different cups.
But we're going to have...
And then in tag, there's different places you run in.
Something like that. We're going to start. So we're going to have two different people. Who is going to be, let's see, we have a Maria and I have another character named Percy. Who wants to be Percy and who wants to be Maria?
I'm Maria.
You're Maria?
I'm Neal.
No, you're Percy.
All right, I'll give you the name Neal.
Yeah.
All right, so you have two choices for breakfast every day, okay? You can have a loaf of white bread from the supermarket or a watermelon or apples or bananas.
Or strawberries.
Or strawberries.
Strawberries.
Okay.
I choose strawberries.
Or grapes.
Sure. All right, so we're going to go through two scenarios of two different kids who each choose different types of foods for breakfast or for their meals. Okay? All right. Neal wakes up every day to find his favorite peanut butter and jelly sandwich on the kitchen counter every morning.
Actually,
Neal's mother knows he doesn't like indulging in some specific foods because, according to him, they are boring and don't taste as nice.
what do you mean?
And she doesn't want him wasting food, which he has done in the past. So she gives him a peanut butter and jelly sandwich every day. After breakfast, Neal is ready for school. He's energetic and feels like he can conquer the day.
That never happens.
He leaves home in a rush, excited. But by the time he reaches school, he feels lethargic. He sees his friends, William, Beck, and Nancy, playing in the field. He wants to join them, but he feels like he doesn't have the energy to do that. By the end of school, Neal returns home, defeated, until he has his favorite peanut butter and jelly sandwich again the next morning where he feels like he can do anything.
What the? Everything.
Okay,
That's
next.
boring.
Okay, now...
So boring. Such a
Maria. Me.
Okay, now let's take a look at his classmate, Maria. Maria was a fussy baby and often had to go to the pediatrician as a child. Although she didn't think very much of her health, I mean, who does as an 8-year-old?
Me.
Maria was instructed to have more fiber in her diet. So every morning, her parents made sure that she ate whole fruits instead of juice or smoothies. The breakfast doesn't excite Maria as much as Neal's breakfast excited him. But she thinks it's best to listen to the doctor so that she doesn't have to go back to the doctor. Now she's ready for school. She feels good even after reaching school and finds a lot of energy when she wants to play with friends and pay attention in class. Maybe it's not that clear to her, but Maria doesn't feel drops in mood and energy that classmates who often indulge in processed veggies and fruit-based dishes. So I want you to talk to me a little bit about what's the difference in the experience between these two kids. Seemingly, they're both healthy, right?
No, not really.
Well, if you look at them from the outside, they don't look like they're unhealthy. They look like they're both healthy, active kids.
Yeah, but they're not.
But they both have sufficient food.
Neal's not healthy.
I'm healthy.
They both try their best. They both try their best in everything that they do. Okay, but why is one so different from the other? You can tell the energy levels are different.
When you have sugar, which comes a lot in white bread, peanut butter, and jams, not as much in peanut butter, but a lot in jams and white bread, you get spikes of blood, so it goes up and then it drops down. Then it goes up and it drops down. And
But
so
eat
when
that.
it goes down, you don't have very much energy. So when you first eat it, it goes high up and then it just drops down and you don't feel good for a long time.
Okay.
But whereas if you have vegetables and healthy foods like fruits, it goes like this. It goes a little up and then it goes straight, and sometimes it'll drop a little bit down, and it just keeps going along.
But it stays pretty consistent,
Yeah.
right? Your blood sugar is.
Or
staying pretty
sometimes it
consistent.
just goes like this.
Well, you don't want it to go up like that either, right? You want it to be kind of at a
Don't you
steady-
want it to just go like?
Do you want that to happen
No.
though? No, we don't want that. All right, so let's talk a little bit about sugar, okay? So when we talk about sugar, when we talk about like how our body uses sugar, there's different kinds of sugar. There's a lot of different forms of sugar that we eat in food. But our body really likes to convert almost everything as much as it can to glucose. Okay. Glucose is like, it's a single building block and it's a type of sugar, and that's what the cells of our body, right? So our muscle, our liver, our brain, you know, different parts of the body, that's what they like, it likes to use as energy, as fuel, so that the cells can function. Does that make sense?
Yeah.
Okay. So we use glucose. Most of the times our body tries to use glucose. There's also there are different kinds of sugars. So there's another kind of sugar called fructose, which is a kind of sugar that you find a lot in fruits.
Like high fructose corn syrup?
You do find fructose in high fructose corn syrup. And so that's a good transition. But before that, I just want to tell you where we find it naturally, because high fructose corn syrup is man-made. It's artificial. Okay. But fructose is another kind of sugar that is found in fruits, for example. But it's found in small amounts in fruits, and it's packed with other nutrients like fiber, which is really important for the body. Okay. So we don't end up eating a lot of it because of that, because fiber also makes you full. Okay, so we have glucose and we have fructose, and we have high fructose corn syrup.
Yeah.
Okay, so high fructose corn syrup is basically something that comes from what? It's in the name.
Corn?
From corn.
Oh.
Yeah. So when we talk about table sugar, that comes from either beets,
What's table sugar?
sucrose. Okay.
Like the one you put in tea? White sugar?
Yes, yeah, so exactly, that white sugar, okay? So that comes from sugar cane. It's processed from sugar cane, or it comes from beets, okay?
Beets?
Beets, yeah, beets.
BEETS?
Yeah, so you can get it from either one of those sources. So, but those aren't as abundant. Now, high fructose corn syrup comes from corn, which there's a lot more corn, and so it's a cheaper way of getting it. And so when we have high fructose corn syrup, what ends up happening is we end up getting a lot more fructose than we would normally need. Okay? Okay. So I would
How
actually...
do they make the corn? Doesn't really have that much fructose.
They actually convert the glucose to fructose in high fructose corn syrup.
How?
There's a whole milling process, and there's a whole conversion process that it goes through.
Where?
On YouTube.
In factories.
Which factory?
In the high fructose corn syrup factories.
How many are there?
But the good question is, why so many, or I don't really know how many places actually produce high fructose corn syrup. I'm not aware of that number, but I can tell you that high fructose corn syrup is way cheaper to make than table sugar. Okay?
Why?
And high fructose corn syrup is a
Why?
combination of
Why?
fructose and glucose.
Why?
Why? Because corn is way more abundant than sugarcane and beets. So because there's so much more of it, that's one reason. The other thing is that high fructose corn syrup, the fructose is, there's a perception that fructose is much more sweet. So we need less of it to make the same food that same sweetness. Does that make sense?
So?
Yeah.
Who cares?
Well, it's money. It's the cheapness of it. And
Dinero.
yeah, high fructose corn syrup has, so one is it's cheaper. Two is it has something called a mouthfeel. So we actually tend to want to have foods that feel really good in our mouth, right? We have that sensation, that perception of what the food tastes like.
It's just syrup.
It is.
So
and because it
got
comes in a liquid form, it's much easier to use. you don't need as much of it per gram to add to foods as a sweetener.
Okay.
Because it is already perceived as being sweeter than glucose is.
Oh, okay.
Does that make sense?
They're
Yeah.
both sugar.
It does
They
make
are
sense.
both sugar.
So why does it matter?
It makes sense to me.
Well, the reason that it matters is that our body is not equipped to handle that much fructose. Really, the only part of our body that can process fructose is the liver. But when we take so much fructose into our body, it puts a lot of strain on our liver. Our liver has a lot more work to do. And we could end up getting diseases because the liver has to work so hard to process that food, to process that sugar.
So what make the liver work hard?
You want to make the liver work hard? Then the liver gets sick.
Why? To get some exercise.
Well, no. It's not like exercise where you're like, oh, this is going to make me work harder, so this is good for me. This is actually more like these foods are already bad for me, and it's going to make my organs work harder, and it's going to make them sick. Can you think of some foods that have high fructose corn syrup in it?
Marshmallows.
Okay. By the way, also a lot of different yogurts have it, and people think that yogurt is healthy, but a lot of yogurts.
The yogurt's junky. Cereal.
Cereal. What else?
Starburst. Skittles.
Mm-hmm.
Chocolate.
How about sodas like Coke?
No
Anything.
ketchup.
Mustard, condiments.
Salad dressing.
Oh my gosh, you guys totally know this. I have a really good idea. We have a challenge where I time you and I want you to go through the grocery store and pick out foods that have corn syrup or high fructose
Oh, I
corn
am
syrup.
so gonna beat you.
No, you're not.
Yeah, I am.
Here's the problem. When we have a lot of sugar or we have a lot of excessive calories, which you can easily get with these kinds of foods, these kinds of things cause damage to our body.
Okay.
Okay, so we have to be really careful and cautious about it from the very beginning. I'm going to talk to you a little bit more about something that we've kind of mentioned a few times, which is diabetes. Okay?
Okay.
When you're sliding into home and you're feeling something called diabetes.
Okay.
It's actually diarrhea.
Do you guys know what diabetes is? Like, what is your understanding of diabetes? Do you know what it means?
No, Bob has 37 chocolate bars. He eats 29 chocolate bars. What does Bob have now?
I don't know.
Diabetes.
Oh.
Diabetes. Diabetes.
All right. So a lot of people think of diabetes as a sugar problem, but it's actually way more than that. We're going to be talking about diabetes and how this whole thing works, because I don't think that a lot of people really understand. Excuse me, that's my blood vessel. I don't think that you really
But your
understand.
blood vessel's inside your body. And why is it blue?
Okay, so now here I have set up what I think is going to be able to mimic what happens in diabetes. So here we have a cell, okay? And this is cells of our body, our muscle, so all of our organs, our liver, all of that, okay? Okay. Here we have a blood vessel, okay?
Okay.
It's supposed to be red, but it's blue today. Now here I am. These Skittles are going to be
Diabetes cells.
these sugars are going to be what I'm eating, and it's going to be broken down.
Skittles?
This is these are sugar. These are going to
You're
be
gonna
glucose.
eat Skittles, actually.
Okay. So this is going to represent glucose. Okay. So I'm eating food.
Neal, she didn't actually eat it. Look at her hand.
Okay. Now this gets converted into glucose that's in my blood vessels. Okay. We all have glucose. Everything that you eat, most of it gets converted into glucose. So then you have this organ in your abdomen called the pancreas. There are these cells in the pancreas called beta cells, and they make something called insulin. It's a hormone. Okay. So basically the pancreas is like, oh, look at that. Look at all this glucose is here. I'm gonna release some insulin. Oops. Here.
Ooh, I like those pink papers.
Okay, what this insulin is going to do, it's going to unlock the cell. So right now this cell's door is closed, and this glucose needs to get inside the cell.
Okay.
All right. So, but what it has to do is that the insulin has to come and unlock the door and open it up so that the glucose can get inside of the cell. So now here you have these things called insulin receptors. Okay. It's basically like the lock. All right.
Okay.
So the door's locked, and the insulin is the key.
Okay.
All right. So now, what's gonna happen? Excuse me. All right. Is that
I still keep these
that
insulin.
in a normal person, what will happen is that the
Oh, insulin will go inside the
it'll
lock.
unlock. Can you unlock it? Can you unlock?
Can
the
I
door?
put one?
Unlock.
No, Neil, that's not how it unlocks.
Right here. So it has to fit. Okay, so it fits in its little space. All right, so this fits here, and this fits here. Let's just say, and oops, it fell off. Anyways, okay, so these things.
They put the gears in and it unlocked.
Yeah, so the key goes in, and the whole thing comes. It's now unlocked, and now there's some other transporters. We're not going to talk about that, but these things. They get inside the cell from the blood, okay? That's normal, okay? Now, we have another scenario, okay? And in this scenario, the pancreas has been damaged. And
It can't send the insulin.
that means, so here we go again, okay? So sugar in the blood vessels, glucose in the blood vessels, okay? Body goes.
Wait, can I guess how diabetes is had? You have so much glucose that the pancreas can't keep making enough insulin to get the glucose and unlock it, and then that's how you get diabetes because it all gets stuck.
Not exactly. But guess what happens? The pancreas doesn't make insulin. No insulin, or almost no insulin. Okay? So then what happens?
All the glucose gets stuck
It gets stuck where?
in the blood vessels
In the blood vessels. Why?
because it can't move. It's stuck right outside of the cell, but it can't open the cell without the insulin.
Right, exactly. Okay, so that's what's called type 1 diabetes, when your body doesn't make enough insulin. Okay, and well, there are different reasons for it.
What's one reason?
Well, one reason there's something where you could have some infections, and that could affect the
But people always
beta
say
cells.
you get diabetes from like the things you eat and the things you do.
So we're going to talk about that in a second. So I'm only talking about type 1 diabetes, where your body's not making enough insulin in the first place. Okay? So that often happens with
Oh, great.
like an infection. Okay? Or any damage to the pancreas, where the pancreas can't make can't make the beta cells in the first place. So now we have a second scenario, okay? So this scenario is now we've eaten the meal, and now we have the glucose in the blood vessels, okay? All right, and the body has gotten the signal that there's glucose there. Please send the insulin out to the blood vessels, all right? So the pancreas releases insulin, okay? But now there's a problem, not with the insulin, there's a problem on the receptors. Okay, so it's not that the key doesn't work, it's that there's a problem with the lock, and the lock will not allow the door to open. Okay, so, like this, it just gets kind of ruined. All right, this happens when there's, it's something called insulin resistance. And that's what we say is type 2 diabetes. And usually it happens in the face of a lot of inflammation in the body that is often starts off with a lot of excess fat in the abdominal area most of the times.
I just have a question for you. You've done type 1 and type 2, but how many types of diabetes are there?
It's just 2 types of diabetes. Yeah. So when we treat, like if we were to treat type 1 diabetes, what would we have to do for that?
We would just make more insulin.
Yeah, so we would have to take insulin. So people with type 1 diabetes, they get injections of insulin. They check their blood sugar level, and they then say, okay, this is how much insulin that I need to have in order to get the glucose into my cells so that it can work as energy and fuel. And they take insulin injections, and that's it.
Why don't they just take pills?
Because that's how it would get absorbed better if it goes through directly into the muscle, into the bloodstream.
Make pills.
There's
swallow pills?
No, there's a whole processing that it wouldn't work. By the time it got into the bloodstream, it wouldn't work.
Okay, and just another question for you. So wait, like number 2, like how do we treat number 2?
So number
just
2,
make more blood cells.
Well, there's different ways of doing it. Well, it's a good thought.
Kill the other blood cells.
Not killing the blood cells. The blood cells are here. I'm talking about like just our normal cells, like our muscle cells.
Wait, I think I know. Do a bunch of exercise and get rid of your fat.
That's one way to do it. So there are different ways that people do it. One is that they take medication to help to decrease the resistance, okay? So medications can help with that, all right, in different ways. But, you know, the preference and what we like to talk about is how can our lifestyle help that? So the kinds of foods that we eat, getting lots of exercise, these are things that can help to reduce that resistance. So does that make sense of what happens and why we can do it? Sometimes these people also end up needing some insulin too. Okay. But for the most part, it can just be treated with
exercise and getting rid of your belly fat.
With healthy habits. So eating healthy foods. Also eating foods that are not ultra processed.
So just a question. So it seems like type 2 diabetes you can easily get rid of if you lose your belly fat and you keep your healthier habits. Not like you lose the belly fat then you go back to it. But if you keep a bunch of healthy habits, type 2 diabetes will be gone.
You could reverse type 2 diabetes.
Okay, but for type 1 diabetes, if you have to keep taking the shots, how can you reverse that? There's no way to reverse type 1 diabetes at all.
You can't reverse it. You can't reverse type 1 diabetes, but you can reverse type 2 diabetes.
Okay.
But the type 2 diabetes is what we're seeing a lot more of.
Okay, so
that's more common.
In which case, if it's a life or death situation, you have to choose between both types of diabetes, which one would you rather have? You would choose type 2 because it's easier to reverse.
You can reverse it as long as you take the steps to reverse it.
Yeah, so if it's a situation where you have to get one of the diabetes, you would want to choose type 2.
I guess. I wouldn't want to have either one of them.
Yeah, but I mean if you had to. Then...
But type 1 I could treat it without medication. Let's say that. Okay, type 1 you need medication, type 2 you can treat and reverse without medication.
I know somebody who has diabetes.
Yeah.
I think it's type 1.
You really?
Yeah.
Okay.
Stacy McGill.
I don't know who that is, but we're not saying their name.
Oh, it's from the Babysitters Club Netflix show.
Oh, got it. So when you get diabetes, you know, when there's too much sugar, so in the end you end up having a lot of sugar that's floating around your blood vessels. Okay.
Don't you just get fat?
And this can cause a lot of damage to the blood vessels and a lot of damage to the body when there's too much sugar floating around. Okay. And there's a lot of other biochemical processes. I'm not going to go into all of it right now.
Okay.
But essentially, when you have all this damage to your bodies, you can have what's called a neuropathy, or your nerves don't feel things as well. So your fingers and your feet, like you can't feel as well, and you can get injuries to them and not even know that you've had an injury. And then you can get these ulcers, and then they can get infected, and yeah, it's really sad. And sometimes they even have to amputate a limb. Yeah, so you can go blind from it. It can cause kidney failure. You can go into a coma from diabetes.
Type 1 or type 2?
From either one. It is not a fun illness to have, especially if you just don't take care of it.
I have diabetes.
You don't have diabetes.
And now I'm reversing it.
How can we avoid these problems from the very beginning, okay? But how do you not have these issues? How can we prevent this? So this isn't just the reversal and the treatment, but we can also prevent these problems. We can prevent ourselves from having type 2 diabetes.
Okay.
Or if you just get diabetes, play an Uno reverse.
Okay. So we're going to talk in the next part about how we prevent ourselves from even having these issues, or how do we reverse it. And a lot of that has to do with the things that we eat. We're going to talk about portion sizes, and we're going to talk about the foods that we have and how we can approach the way that we eat a little bit better so that we don't end up having that abdominal fat that can cause that inflammation.
Okay.
Cool?
Yeah.
Okay.
Remember when we went to dinner on Friday? You ate about 17 cut strawberries, 6 whole strawberries, and I only had 1 tortilla with stuffing that had another tortilla on top. You had 3 tortillas with stuffing inside.
Yeah, so if there's something that you don't like that's on your plate that you need to eat, sometimes I like to eat those parts first so then I can get to the part that I enjoy. Like if it's mixed into a dish and you don't really have anything else to eat,